Hi, Krishma. Nice to meet you.
Hi, Dr. Koning. So happy to see you today. So you're such a pioneer in the field of islet transplantation. How has islet transplantation evolved over the past decade?
So, what I think happened over the past decade is that we've been performing donor islet transplantation like we've been doing for a very long time, improving the islet isolation technique, improving the way we treat our patients, also with immunosuppressions and the right of transplantation themselves. But one of the most exciting developments in the field is that we can now generate islets from stem cells. And I think this is a really important development.
Do you think there's still a role of a whole organ pancreas transplantation, or is there a need to balance between the two?
What I think is going to happen is that for the next years, as long as stem cell islet transplantation is more or less still in the research field, there's still a place for donor pancreas transplantation, especially in the context of combined kidney pancreas transplantation. Now, if we start to learn more about stem cell islet transplantation, if we can really show that it's efficacious and that it's safe, then probably the solitary pancreas transplantations will be taken over by the stem cell islet transplantations. And well, perhaps, in the very far future, also the combined kidney pancreas transplantations will be, how do you say that, replaced by kidney stem cell islet transplantations. But this is a view for the future.
Yeah, I think that'll be really exciting times if that really does happen. What do you think are the biggest clinical advances that will lead to improved outcomes in islet transplantation?
So currently, the problem in donor islet transplantation is that we still transplant a marginal mass or a islet mass that is too small to render a person with diabetes completely insulin independent. So we need a larger islet mass, and there is a lot of destruction of this mass upon intraportal transplantation. So with the current number of organ donors and also the donor characteristics with more marginal donors, older donors who already have a more reduced beta cell mass, because that's what's happening over age, over time, it will still be problematic to get a large enough islet mass. So therefore, we need alternative cell sources. And of course, if you think about stem cell islet transplantation, it would be an elective procedure where you do not have to have this time on the waiting list. You can have a sufficient islet mass, more predictable, more robust in quality. So this would be the advantages of an islet, but of course it has to pan out. It has to be shown in clinical trials that this is indeed the case and that it is safe. But that is what we need for our patients. We need a large enough islet mass so that one islet transplantation is sufficient for a very long efficacy of the transplant.
Okay, so you've started from small numbers and then you have built it into a national islet transplant program at your center. So what have been the key factors that have led to a successful program?
Yes. So what is really important is that you have a very good islet isolation team with a good critical mass of people who are knowledgeable at islet isolation, and also people who are willing to improve islet isolation techniques and together with the clinicians, improve the islet transplantation outcome. So for us, what really worked is enough support and a large enough critical mass of people that know how to transplant, because it's demanding on an islet isolation team to be ready 24/7 and to perform islet isolations and transplantations any time of the year. So And then I think what is very important is to couple a human islet research program to it, because that is beneficial, I think, for generating funds to perform the research, but at the same time to have researchers that participate in the islet isolation program and the other way around. So the people, it's all about the people.
It is, isn't it?
Yeah.
So I think one of the most exciting developments in recent years has been the stem cell derived beta cell replacement therapies. And do you think realistically we are there today?
I do not think we are there today. I think there are still a lot of challenges when it comes to manufacturing, when it comes to distribution, when it comes to uncertainty of the safety, when it comes to uncertainty about long-term efficacy, when it comes to cost. So there are still a lot of open questions, but conceptually, the fact that it is possible to obtain insulin independence in patients with type 1 diabetes using stem cell islets, I think that is really a major achievement. So in my view, stem cell islets are there to stay. But there still needs to be a lot of questions answered in order to have it available for a much larger population of people living with type 1 diabetes.
And do you think in the future, maybe these therapies could be delivered without long-term systemic immunosuppression as well?
So the next major challenge, of course, if we want to make it available for a larger number of people, is that long-term systemic immunosuppression is not necessary anymore. So with current developments in gene editing, in my view, this is very promising. But again, we have to find out which genes need to be edited, and how safe is the stem cell islet preparation after these edits. And this, of course, has all to be researched first. So again, there's still a lot of things that need to happen before we can really transplant genetically edited stem cell islets in a very large number of people.
Yeah. And I think you've talked about this a little bit before, but what do you think can be done more to enhance the graft viability in cell-based diabetes therapy?
So what we know now about islet transplantation is that probably we lose about 50% of the islet mass upon transplantation because of this process, immediate blood-mediated immune reaction, IPMIR. And what we need to do is to have a strategy where we can improve the survival of the islets that we transplant at the moment for donor islets, but probably also for stem cell islets. Although with stem cell islets, you could potentially make more if you can calculate in a specific loss of islets. But long-term survival is really important.
So you also serve as secretary of the International Pancreas and Islet Transplant Association, and TTS greatly values IPITA's contribution to TTS 2026. We are also pleased to be partnering with IPITA for its 2027 Congress in Montreal. Can you tell us a little bit about why IPITA is so important to its members and the broader transplant community?
IPITA is really a wonderful organization because it's in IPITA, there's the surgeons, there's the people transplanting islets, both from the surgical but also from the endocrinology side. There are the basic scientists, and they're all focused on one thing, which is kind of improving the lives of people with type 1 diabetes through transplantation. And with the current developments in stem cells, there is so much opportunity for research, for improving the outcome in patients. And I think that all culminates together in this IPITA meeting in Montreal in 2027. So yeah, people should be there. You shouldn't miss it.
So you'll, of course, be present at TTS 2026 conference in Sydney. And what sort of papers or abstracts are you most excited about, or you're hoping that will be presented there?
I think any paper in the field of pancreas and islet transplantation, donor pancreas, donor islets, or stem cell islet transplantation, or in fact also basic islet biology that has some relevance to the transplantation field are really exciting. I mean, it's usually young people with fresh ideas, thinking out of the box, expanding the knowledge. So I think all the abstracts that you can send in would be great to review and to see in the sessions at TTS.
Professor Koning, thank you so much for sharing these insights today. It was such a pleasure talking to you. And this is clearly such an area of rapid scientific and clinical development. And we look forward to continuing these discussions at TTS 2026.
Well, thank you very much. It's been a real pleasure, talking about this such interesting field. Well, hope to see you and many other people at TTS.
Thank you.